mission is to, in my mind, is to provide health care to people that don't otherwise have it. So that is in the way of medical care, dental care, surgical care, eye care. These people either do not have any access to care, they can't afford the care, it's difficult for them to get to a place that can provide the care, and so we go to them and provide free care.
I'm Kaelin, and I'm in the Bachelor of Science program. I'm a second semester junior here at MCAD, and I am involved with the Human Factors class. Last semester, it was a team of people that worked with International Health Service of Minnesota, and two of us, myself and Reno, got very excited about the project and wanted to continue with it. The Human Factors class, it's probably one of my favorite classes that I've had at MCAD so far. It goes over the human condition and our biology, and Jerry really encourages us to put ourselves out there and to really understand our clients.
Honduras to communicate better strategies to implement.
So with the project, there's only so much information that you can get about a region that's indigenous people. There's only so many books that have been written about it and websites and people that have been there. And trying to do this research, you can only find out so much. And so there were so many gaps in the information that we were able to collect. And so that's one reason that pushed me to actually go there and see everything for ourselves. And we filled some of the holes with the research by just being there. And you just stand back and you observe, and there's so much that you can learn just by standing there and listening and seeing and the smells, everything. The boat ride was long, but you had time to, meet everyone, chat, and kind of take everything in, and it definitely was its own pace. Ran into a little bit of rain on the way there. A lot of rain. That was funny for everyone who was on the boat and saw me. But the boat ride was its own trip in itself. The people of the villages that we were researching, from what the impression was from what the research we got, and then from what we actually saw, there was kind of two different things. Going down the river in the boat, everybody from these villages comes close to shore and they're waving at you, or they're staring, and then you wave and they're smiling and waving back, and it's almost like you feel like Miss America going down the river. You just wave.
What is your name? They look like they need to be. Oh, look at the chickies.
And it was very welcoming, and even when we got to the villages, they were expecting us, and everyone, the whole village, everyone was there helping us unload everything to get it in the right spots to the schoolhouse where we had set up our kitchen area, and then clinic, and then where we were sleeping. So everyone was there helping us and hauling camera equipment or all the water.
I was the team leader on this team, which in that role I did some of the organizational kinds of communication before we went down. help to decide who the team members would be, what skills we needed, what the backgrounds of the people were. Were they people that would be a good fit with IHS? Okay, all right, that's a good idea, okay. Okay, Reno, now let's see.
Nini bulma somya bela. Nini bera magmo somya. Banan ba 1, 2, 3, 4
Okay, Andreas, would you tell them we're going to give them the worm medicine, but if they're pregnant, they need to tell us when they come in the clinic. Okay?
Today we've evolved into what I've seen with the change in students within the last 10 years is that the students today truly want to make a difference. They're not satisfied by having a lecture, having another lecture, writing a paper, taking a test and doing another lecture and that sort of thing. They want to participate. They want to believe and feel that they can make a difference. And so what we've done with our projects in entrepreneurial studies, the students have an opportunity to make a connection through the arts, to business, and to science. And we work in professional collaboration with real clients on real projects with real outcomes locally, nationally, and globally. The students have a different feel and interest to them. The idea that Bachelor of Science students always wanted to go to a creative school, true, but they didn't want to be a studio artist. And when you look at the other programs around the school, they tend to be siloed by their media, film, video, photography, sculpture, painting, furniture, all of those sort of things. In our program, they have a hard time defining it because our media are people. And we encourage all our students to have skills or a whole focus in those areas because they have 27 credits of other studios that they can take. You come in with photographic and media skills and all of those sort of things. That's what we want you to develop. But what we add on top of that is this relationship with the client. And what we have morphed to in the last decade probably is that the clients are really broad range now. In the aesthetics of sustainability, we work in 5 continents. And one of the things that's really unique is that these are 5-year-long projects.
You ask them what they got for problems.
First of all, we're a team member. That's the absolute most important, is that we're all a part of the team. Every person on the team is equally important. No one is more important than the other. I think that it's important that we all pitch in and work together, and we don't stop working till everybody's done. I do think that having the group make decisions is the best way to go because then you get everybody's input, and there really isn't a right or a wrong. It's really what does the group want to do.
In Honduras, I coordinate the medication for all the different teams, and that starts with ordering it back in the United States. We also order some from Honduras and organize that when we get down there. It all needs to be divided up into teams. Ahead of time, we determine a formulary that's cost-effective and appropriate for the diseases we encounter in Honduras. Parasites due to impure water, some nutritional deficiencies due to inadequate diets, infections due to untreated wounds, and respiratory issues. Those are the main things we encountered. Lately, in some of the villages that have developed better access to the modern world, we're seeing an increase in diabetes and hypertension. You know, they go to the bigger village and they load up on soda pop and chips. So we're seeing some of the same issues we have here in the United States. I definitely feel that the MCAD students were helpful. I think it's important that they saw, you know, what the medical mission is like. And that way they can help us determine what sort of educational brochures, multimedia presentations that could be developed to promote education in the villages, particularly with laptop computers and stuff. They could develop a little movie, for example, that would demonstrate hand washing or how to clean a wound, brushing teeth, that sort of thing, in addition to perhaps posters or something like that that would explain how to avoid getting parasites and issues like that.
What was so remarkable is that you felt that your client, which was the nature of their own siloed world of basically delivering services, which they do as volunteers on the health ends, a short amount of time, they don't have time to really look around and discover what their music is and who are the informal leaders and what's their economic structure and all of those sort of things. And you and Katie looked at it and said, we need to get the real information. So taking the skills that you had, you volunteered, went down, worked with them, and then created this whole storyline to hand off to the next class. That is so unusual. Only does that happen in offices where somebody's directed to do that. And so you and Katie and the whole group of students we have in that really model this behavior is that you're thinking beyond just yourself. It's an ancient Japanese strategy. You never plant a tree for yourself, you plant it for the next generation. And so this activity just warms my heart to no end to know that people really get it and are really following up on it. And the students are going to benefit so much. And you guys will be coach for a next set of students. So that is, to me, the college of the future.